My name's Brent. I just want everybody to know about Dr. Talei. Do your research. It's up to you to find out what it is that you're going to get done. Don't just put your trust in the surgeon. Look at the before and afters. That is the most important thing, right? Because he can tell you anything you want to hear, but the proof is in the pictures, and you can see the before and after. Make sure they're consistent. The picture taken before is in the same room as the after with the same lighting and no photography tricks. When I hit 50, I started to notice laxity and just wrinkling of the skin right under my chin. This was the original area that I wanted to get fixed. And of course, when I was younger, I always felt that I had a weak profile, and that only got worse as I got older. When I found Dr. Talei, what he would do on his posts on Instagram is educate you.
Instead of 4 incisions, we shrink it down into 2 small incisions that go behind the hairline, get a big release in the brow, and bring it up.
Dr. Talei does a deep plane facelift. And what's happening is everything is being released and brought back up. So by doing that, you get the most natural result like you see on me, which is there's no tension and there's no pulling and there's no that swept look. I mean, you even see people in Hollywood that it's astounding. They have all the resources in the world, but yet they have this surgery where you can tell they had surgery. So it was really important to me that I find somebody that could do something natural. I went and saw a doctor who was going to put a full implant in here and then take this area and pull it up. I don't know how that would have turned out, but I figured that Dr. Talei was going to suggest the same thing. He said, no, we're not going to do that.
So I call this laryngeal setback, where I actually grab the entire larynx, which is the throat and the thyroid cartilage, cricoid, and the trachea, and I bring it back. So if you look at the width of the neck from the front and from the side, it's actually shorter now.
And you can see the balance is perfect. If there was an implant, that would look a little bit off. This looks more natural, doesn't it?
And these stubborn wrinkles back over there, they're all improved versus worsened. Most guys, when they do this, they actually get them worse because they bunch up the skin over there. But this is a much more vertical type of lift. And you can see how the larynx there again is like set back. And that's how we got the definition there by a laryngeal setback. So this broad neck now is a narrow, normal size neck.
Everything along the way just kind of pointed into the direction of Dr. Talei. He's so transparent. He tells you everything on social media. Whatever procedure you're getting, go look at his podcast. There's a podcast on it. There's a whole podcast on the surgery on the AuraLyft that explains the entire procedure. I also put my trust in him, even though after the surgery, daily I would be like, what's this? What's this? What's that? And I also saw a post about nervous healing that a woman that works with him did.
Because that's reality. You don't look great 3, 4, 5 weeks after surgery. You're still swollen. So you have to remember, it takes a full 3 months for swelling to go down, sometimes even a little bit longer.
And it's true. If you're a stressful person, you're going to find a lot of different things to worry about. Came back 3 months. The swelling I was concerned about under here, gone. The swelling I was concerned about over here, gone. You know, I love to like pull my hair up and show people like, show me where the incisions are. And they're like, what? What are you talking about? Most people don't believe that I had anything done.
The incisions do come all the way up here. So they're right there. They come around there. They go in there. And people always want to see them, but that's what they look like.
Just educate yourself and come see Dr. Talei.